What is the best next action?
Okay, two-step, let's go.
Uh, a 62-year-old male has crushing chest pain, nausea, and diaphoresis.
Okay.
I'm thinking sick.
Okay,
Um,
I think he's sick, so we probably need to do something. Keep going.
his BP is 92/58.
Hey, somebody calculate his MAP for us. How do we calculate the MAP again?
Systolic times systolic plus diastolic
Plus twice the
times
diastolic.
2. Oh yeah, over divided by 3.
Okay, so we're going to do 58 times 2 plus 92 divide by 3. And what do you all come up with? Somebody calculate the MAP for me. What'd you get? Okay, 69. I like that. So we have a MAP of 69. Okay, right now he's hanging on, but he's probably going to fail soon if we don't do something about it. All right, keep going.
Heart rate is 54.
Okay, so he's bradycardic. Ooh, crushing chest pain. All right, hypotensive and bradycardic. Just by that alone, what type of, even without an EKG, what type of infarct am I likely to suspect because he has bradycardia versus not having bradycardia?
Inferior.
Okay, why would you suspect that I would have an inferior involvement compared to not having that?
Because I'm thinking the right coronary artery.
Come on, my man, keep going. Let's go.
Yeah. So 85% of people get their blood flow from the right side.
Okay.
And
so that's called right dominant.
Yes.
And what are the branches off the right coronary artery?
The SA.
We have the SA nodal branch. What else?
The AV nodal
we have the
branch.
AV nodal branch. We also have this marginal diagonal over here. So because the SA node, which is the main pacemaker that sets the heartbeat, it gets its blood supply from the right coronary artery. If they're bradycardic, I have a high suspicion of an inferior infarct. What leads is that going to be?
Leads 2, 3 in AVF.
Okay, and it needs to be how many of those?
2.
It needs to be at least 2 contiguous leads. So 2 leads side by side in a group that go together. So you told me 2, 3 AVF, and the question actually tells us that it was 2, 3 AVF. So our suspicion is right. Okay, keep going. So we would say this patient is having an inferior MI. What else do I need to do when I'm doing the 12 lead if there's inferior involvement?
You need to move V4 to the right side.
I'm going to move V4, move it to the right side of the chest, and now I'm going to run another 12 lead and call that V4R. Okay, and I'm going to write V4R on the paper. All right, he took
sildenafil 6 hours ago.
Okay, what is that? What's sildenafil?
PDE5.
Man, my man. Okay, you're showing out for real. That's a PDE5 inhibitor. No, I love it. That's a PDE5 inhibitor. And that class of drugs is what treats the condition erectile dysfunction. Okay, why did they tell us that information? Because what's special about sildenafil or any of the fils, whether it's tadalafil, vardenafil, any of the fils, what's special about them?
They cause dilation.
They cause significant vasodilation, and they're a contraindication for what medication?
Nitro.
Okay. Nitro. Because nitro also causes venodilation and vasodilation. So we don't want to make the vasodilation worse. So find me an answer. What are we going to do for this patient? Well, first of all, in acute coronary syndrome, what is our treatment of choice?
Avon.
Okay, let's go Avon. So what's the A?
A is aspirin.
We're going to give aspirin unless it's contraindicated. When is it? So first, when you come in the door, we say, bam, give them the aspirin. Bam. Those happen to be the contraindications. So we're going to go, bam, take this aspirin unless you have bleeding, allergies, or you've taken the max dose. Okay? So bleeding, allergies, taking the max dose, no aspirin. Otherwise, take this aspirin. All right? Then we're going to give vital signs. We're going to give oxygen if necessary, like if they're showing signs of hypoxia or respiratory distress. or we'll give nitro unless it's contraindicated. In this case, is nitro contraindicated?
Yes.
All right, so let's get rid of the nitro. Do we need oxygen in this case?
No.
Probably not. Not yet, because he's not showing any respiratory signs. Well, he may, but right this moment, that's probably not our first choice. So even if they give us an answer choice, that's probably later down the list. Do we need vital signs?
Yes.
Yeah, because we definitely need to know the blood pressure for the nitro. But in his case, because he took a PDE5 inhibitor within the last 6 hours, that's a contraindication for it. And then aspirin, unless there's a contraindication. But aspirin would be our first drug of choice. So find me an answer.
B.
We're going to go B. Let's see. Withhold nitro, give aspirin. Okay. Yeah, I like that. So just like that, that's going to be our treatment there. All right.
I had a question.
Yes.
I had a question. So for the heart rate obviously being 54.
Hold on. Say it again.
For the heart rate, it was 54. That's just included in just the SA node, not the AV node.
Well, both, because the
both.
So I mean, both of them could be affected. They're both supplied by the same artery. It just depends on how high up the blockage is. But remember, the SA node is what's the first one. So that it's this concept called overdrive suppression. Basically, it means you have a backup to keep the heart alive, because we got to keep the brain alive. So when the first one, the SA node, when it goes crazy, then the backup to that is the AV node. When that fails, then the backup to that is down in the Purkinje's. Okay, so we have multiple backups. That's how God created it, so that the heart just doesn't quit. Okay, because remember, we got to keep the brain perfused. But
I have a question.
It just depends on how high up the artery, like which one of those branches got affected, or if any got affected. It depends on the blood vessel and where the blockage is. All right, who else? Who was asking? Who said they had a?
I have a question,
All right.
Maris.
Who's talking?
What is the national? It's Maris.
Maris. Okay, what you got?
What is the national standard for a systolic blood pressure for nitro? Because in New York, it's 120 systolic.
Okay,
I know it's lower national.
I would go with 100. Some things are going to say 100. Some will say 110. Just kind of for simplicity. Like in your test question, you should be able to recognize like low versus not low, but 100 is kind of the benchmark you want to shoot for.
Okay, so they won't directly ask, a question of what the systolic blood pressure for nitroglycerin would be.
Well, I can't tell you exactly what question you're going to have on registry, because nobody knows, and everybody kind of has their own adventure with the registry in terms of what questions they get and how many questions. It's less likely that you would have that type of question, but the way they would ask it is like, they tell you like, okay, so in this situation, let's go back to it. In this situation though, even if the blood pressure was 100 or 110, the fact that this patient had another contraindication, taking sildenafil, that would contraindicate nitro regardless of the blood pressure. Does that make sense?
Yeah, it's a pretty drastic difference between New York and national standards for the systolic blood pressure.
Yeah, so the number I want you to kind of commit to memory is about 100 systolic. And
okay, thank you.
And like I say, it's less likely that you're going to have that type of nitpicky question. It's the concept though of hypotension or other contraindications that you want to watch out for. Okay.
Thank you.
Let's say, hey, Jonathan, you want to take one?